Everybody. It's a pleasure to introduce Carol Davy, who's going to talk to us this morning about what she's been doing around What Keeps You Strong program. So Carol has a PhD in social psychology, where she looks at the impact of belief systems on the use of healthcare services. She's now working at the Wardilly Paringa Aboriginal Research Unit at the South Australian Health and Medical Research Institute. And she's applying those research skills to the activities of the Centre for Research Excellence in Aboriginal Chronic Disease, Knowledge Translation and Exchange, the CREATE programme. And so as I say, today Carol's going to talk about the What Keeps You Strong programme. Thanks, Carol.
Okay, thank you very much. I'd like to start before the presentation just to acknowledge certainly the land of the Aboriginal people that we're actually on at the moment here in Adelaide, which is the Kaurna people. They have a strong connection to the land here, and in particular where we sit, or where I sit at SAMRI, there's a huge connection in the fact that this was in the past a place where people, Aboriginal and Torres Strait Islander people, Aboriginal people came together to share knowledge. So we're very privileged to have this space, which was great. I wanted to go over 4 points in today's presentation. The first one was just to do a bit of a quick overview of aged care services which are utilised by Aboriginal and Torres Strait Islander peoples around Australia, to consider the differing needs and what they may be and why they may be different for these population groups, to think about the aged care reform as an opportunity for improvement, and then talk about, finally, a program of work which we have designed to assist in providing care for older Aboriginal and Torres Strait Islander peoples. So there's a number of reasons why we think this is an appropriate time to step back and consider aged care for Aboriginal and Torres Strait Islander peoples. Firstly, of course, older Aboriginal and Torres Strait Islander peoples have a right to receive aged care that is aligned with their value systems and integrated with their community life. However, perhaps for the first time, there is a clear indication that the life expectancy for this particular group of people is increasing. In fact, the increase in life expectancy for Aboriginal and Torres Strait Islander males is almost twice that of non-Indigenous males when we're comparing between recent figures published in 2012 and the years between 2005 and 2007. The increase in life expectancy for Aboriginal and Torres Strait Islander females, while not quite as dramatic, is also slightly higher than their non-Indigenous counterparts. Importantly, I guess for this particular group of people, or this particular topic, the number of Aboriginal and Torres Strait Islander people aged 50 or over is also growing, although these positive trends come from a particularly low baseline. For example, at the moment, as of 2014, only 12% of the Aboriginal and Torres Strait Islander population was aged over 50 or above, and that is compared with 31% for the non-Indigenous population. So there's still some work to be done. It is, however, as most people would know, widely accepted that due to the poorer health status and higher levels of socioeconomic disadvantage, the healthcare and support needs of older Aboriginal and Torres Strait Islander peoples will probably differ from those of other Australians. So as a consequence, aged care services are provided to Aboriginal and Torres Strait Islander people aged 50 are needed. And this is in comparison to eligible or non-Indigenous Australians that are eligible for aged care at around the age of 70, depending on their needs. And this is sort of shown and depicted in this figure, which is taken from the very recently released report provided by the Productivity Commission in 2015, which was on the government services at 2014.
Oh, God.
I think we're having some interference from Sarah. Maybe your mic might still be turned on.
Sorry.
Okay, that's all right.
We'll switch it off.
So moving on, Given the poor health status and younger age at which Aboriginal and Torres Strait Islander people are able to access aged care services, it probably comes at no surprise to learn that nationally, at the 30th of June 2014, the percentage of Aboriginal and Torres Strait Islander population receiving government-funded home care services was higher in comparison to the percentage of eligible non-Indigenous population in all states except for New South Wales. And don't ask me why New South Wales is different, but I'm sure there must be a reason. So the recipients of home care per 100,000 Aboriginal and Torres Strait Islander Australians aged 50 and over was 22.1. This compared to a total of 17.2 people per thousand in the aged care population for non-Indigenous Australians. What may be surprising, however, is that when we look at the residential aged care options, there is a complete reversal. Nationally, as at the 30th of June 2014, Aboriginal and Torres Strait Islander Australians had lower rates of use of residential aged care services. And that's 18.5 people per 1,000 for Aboriginal and Torres Strait Islander populations aged over 50, in comparison to 51.1 people per 100,000 for the non-Indigenous population aged 65 and over. Some of the reasons that Aboriginal and Torres Strait Islander people may not be accessing residential aged care are probably well known to most of us. The Indigenous people face ongoing challenges actually finding services, particularly in rural and remote areas, and also finding services that are appropriate to their needs and circumstances. And even when they do find services, they often have problems accessing them. There are a lot of forms to fill out. There's a considerable process to go through when applying to go into or being eligible for a residential aged care facility. In addition, older Aboriginal and Torres Strait Islander Australians generally wish to be cared for in their communities, where they can be very close to their family and when they can pass away on their land and in their country. Many mainstream services fail to realise and take account of these particular points, but in addition, also appreciate the multiple interconnected historical, social, economic and political factors that influence the ageing experience of these groups of people, and in addition contribute to their poorer health status and the gap in life expectancy. So, yet despite there was a more positive outcome for home care, as you saw in one of the figures previously, there is still some issues that need to be addressed, and all may not be perfect. A very recent paper, I think almost coming out in the last month, is one by Bell and Lindemann that considered the perspectives of aged care assessment officers, participants involved in service provision, as well as community members receiving aged care services in Central Australia. Not surprisingly, most of these services were home care services or home care packages that were available at that particular point in time. One of the most important issues highlighted by Bell and Lindemann, certainly from my point of view at least, was the difficulties that assessors experiencing in really understanding the needs of the older person and the older person being able to communicate their needs to the assessors. This is particularly because of the various different cultural perspectives that each were coming from, and also in many cases the different languages that were being used to express those needs. These authors also spoke about, however, the issues around the cultural perspectives on aged care and how they're not being addressed by current home care services, in particular in regard to the relationships that are so important, the family relationships and the community relationships in caring for older Aboriginal and Torres Strait Islander people, and the burden that it often places on family who are actually the primary carers. But they also talked about the context of service delivery, particularly in these rural and remote settings where staffing is such an issue for aged care servicing, along with primary health care, where housing conditions are not always appropriate for meeting the needs of older Indigenous people, where living conditions and hardship regarding the social determinants of health, such as the economical factors, people actually not being employed at the present or having very casual employment, places additional burdens on the older person, but also the carers that are needing to actually support their parents and grandparents. The issue of equity and access was also discussed in this paper. The barriers to service entry, again, not just obviously now in residential care, as was suggested previously, but also in accessing home care services, and the accommodation and the cultural expectations around providing things like food, appropriate food, having home services that appreciate the ways in which people wish to live in the community. And finally, this brought the authors to the issue of program misalignment, where the needs of Aboriginal and Torres Strait Islander people were not always able to be met by these home care packages, although assessors were particularly good at trying to accommodate and adapt what was possible. So it wasn't all bad news. So many of these issues are widely acknowledged, and these have actually been acknowledged in particular in both as in part of the new aged care reform packages, as well as the recently released Aboriginal and Torres Strait Islander Health Plan, both for Aboriginal and Torres Strait Islanders more broadly, but in particular for the older members of these populations. For example, the Aged Care Reform Package, which was announced on the 20th of April 2012, involves a comprehensive 10-year plan for everyone to reshape aged care services, providing $3.7 billion over 5 years to build a better, fairer and more nationally consistent aged care system. In terms of Aboriginal and Torres Strait Islander aged care services, however, the reform also includes the expansion of existing measures, which perhaps might help populations such as those that were considered in Central Australia by establishing new residential aged care services and alternative home care packages in areas of high need. The recently released implementation framework for the National Aboriginal and Torres Strait Islander Health Plan also includes 4 very specific strategies to improve aged care services for Aboriginal and Torres Strait Islander peoples. It acknowledges that appropriate services, whether in a residential aged care facility or part of a community care package, must meet not only the health needs, but also must consider how to support the social, emotional, and also cultural aspects of how Aboriginal and Torres Strait Islander people's lives should be managed and supported. So these are some very important, I guess, acknowledgements. We are yet to see whether in fact they make any difference on the ground, and that's obviously in the past where things have come unstuck. So it's from this very, I guess, positive viewpoint and potential for improvement that this new program of work sits. It was a program of work, importantly, that was requested by a number of Aboriginal community controlled organisations across Australia, as well as aged care services, and fortunately enough to be taken on as something worth supporting by the South Australian elders community, or community elders group I should say. The aim of this particular program of research is to identify ways in which we can assist services, that's being primary health care, as well as aged care services in the community and also residential facilities, to support not only the health of older Aboriginal and Torres Strait Islanders, but more importantly, their wellbeing. And wellbeing is taken in this context very much from the older person's definition. And this will change as we move not only from one community to another, but we also appreciate from one individual to another within each community. So there is no static definition that we're working with. We're really fortunate enough to be working with a group of very integrated organisations within this particular sector, and for them to be able to allow a representative to sit on an expert advisory committee. So one of them is a member of the expert advisory committee that we're very grateful to have, is a CEO of an Aboriginal community-controlled residential and home-based aged care service here in South Australia, as well as a researcher who's embedded within and working with Helping Hand Aged Care, which obviously is more of a mainstream health provider, but very interested in the ways in which different cultures need to be acknowledged within a residential aged care facility. We also have the advice and guidance of 2 Aboriginal elders from South Australia, and also an Aboriginal researcher who is currently doing their PhD around what wellbeing means with an Aboriginal and Torres Strait Islander community. So you can see their guidance is particularly important. And I would point out that this guidance goes well beyond simply, I guess, advisory, but in fact they've been integral to the work that's being done at the moment, and I'm going to be telling you about in a second, and also the development of how the work that's already been completed will be taken forward in the future. So we're particularly thrilled. So to let you know what we've been doing so far in this program of work, we've started off, as most programs actually do, I think these days, is with a systematic review. We didn't want to start out without knowing what has already gone on and what's taken place. So phase 1 is what we're calling it, has undertaken a large systematic review which looked at evidence from around the globe about what supports the wellbeing of Indigenous people more generally. People may find this quite surprising, but we thought that gaining a global perspective in the first instance may be able to provide evidence from Indigenous communities in other countries such as Canada, New Zealand and the United States, which could help inform and be adapted to perhaps strategies and resources that could be developed for the Australian context. As with all systematic reviews, we started off with a search of the literature. We did include primarily peer-reviewed literature in the first instance, and our search strategies, which went over the normal databases but also included the Indigenous Health Infonet here in Australia, and a number of other databases, brought up 1,494 findings. We went through their references and came up with another 34 papers that we decided met or could potentially meet the inclusion criteria. A lot of them on an abstract review were actually excluded. And finally, after a full text review, we had 21 papers that were included in the final synthesis. So the majority of those studies were actually conducted in the United States, which is something fairly common, I think, when we're looking at global perspectives in these sorts of issues. And they also, the majority of them reported only on the perceptions of older Indigenous people, but those primarily lived outside of residential care facilities, either in their own homes or in with their families or other carer support. So there's a slightly skewed perspective, unfortunately, but it is a base to start from. We considered that these studies, the quality of these studies was fairly moderate. Most of the studies were they were assessed by the Joanna Briggs Institute appraisal of qualitative studies, and they were really falling down primarily in the area of actually the researcher demonstrating how they were embedded within the research and how their perspectives may have influenced the final findings, which I think is really important. But we actually went one step further, or we believe 2 steps further, in assessing the quality of studies. We looked at whether there was an Indigenous community member involved in the research, actually conducting the research and authoring the paper. And 7 of the studies actually expressly stated that this was the case. This is out of the 21 that were included. And we also looked at whether there was a reference group or an advisory board which consisted of at least some Indigenous members. And 5 of the studies actually expressly stated that they had formed this group. We considered these 2 things to be extremely important. And the reason why is because to really understand the results of the studies and the contextual issues that surround those results, we felt it was really important to have somebody who was at least familiar, if not embedded, within the communities and understanding things from their perspective. This sort of idea about extending out the quality appraisal of studies, I'd just like to flag is something that CREATE in particular, this is the Centre of Disease Knowledge Translation and Exchange that is situated as a collaboration between the University of Adelaide, the National Aboriginal Community Controlled Health Organisation and ourselves here at Wadley Paringa have undertaken. And it's one of their thoughts is to actually look at how other aspects of quality should be considered when undertaking a systematic review, in addition to those that already consider the ethical and methodological quality of research. So I would suggest if people are interested in this and are undertaking systematic reviews, which looks at either Aboriginal and Torres Strait Islander health or Indigenous health more broadly, that they might like to have a look at our website and see where we're up to. We're hoping to publish on this fairly shortly. However, to continue with this systematic review, the results of the systematic review we sort of presented in 2 forms. First of all, we identified the programs that had already been implemented across the world, which specifically were aimed to underpin the wellbeing in some way, shape or form of older Indigenous communities or members of the community. And we found 5 specific programs. One was an assisted living facility in the American Indian tribe, a grandmother's project which was set up in the for Canadian Aboriginal women, another Canadian Indigenous project, and I'm not even going to even try and pronounce the name of that home care program, but importantly 2 programs that actually came out of Australian studies or Australian papers. One was set up quite some time ago in the APY lands. It was a residential facility that was actually centred in community, and it lasted for 18 months. It had some wonderful outcomes, but unfortunately due to lack of funding it ceased operation. The second one was actually an extension almost of that, in the same way one of the communities that was in the APY lands actually supported local women to then again support their own older members of the community. We also identified quite a number of individual strategies that were parts of programs, or alternatively were identified as things that could support the wellbeing of older Indigenous people. So together with the outcomes from the 5 programs and these individual strategies, we did a thematic analysis and ended up with 3 main themes. And I wanted to talk very briefly about those 3 main themes, if I may. The first main theme sort of really talked about the need for services to support people to maintain their own Indigenous identities. And that was really, I guess, facilitated in a number of ways in various programs and suggestions for how it could be done. So one was, I guess, very primarily to ensure that people maintain connection with their family and communities, even though they may move into a residential aged care facility. And some of the ways in which people had already facilitated that was to actually think about where residential aged care facilities are actually situated, to make sure that they're very as close as possible to the communities that people come from. But where that's not possible, to ensure that there are ways in which people can actually go back to their community, to their country, and to their families on a regular basis. It also talked about how it was so important for aged care services to recognise how Indigenous people can actually support each other. So to encourage safe spaces almost within a residential aged care facility for Indigenous people to get together to talk about the things that are important to them. Obviously the connection with their country, and I spoke about before the idea of going back and allowing people to go back to their country, which was important. Traditional ways of living, thinking about how perhaps the use of their language within the care facility, traditional food can be served, and just simple things such as perhaps music that comes from their particular culture, that's a way of actually making people feel comfortable. And finally in this theme was the sense of pride. So ensuring that people are allowed to feel proud of their cultural identity. And that was probably achieved in a number of different ways. But one way that I think was really important and could be easily perhaps replicated in residential care facilities here in Australia is actually encouraging younger members of the Indigenous communities to access the aged care facility and think about ways in which the older people can actually teach their own traditional ways to these younger people. This is actually a concept that is not only going on in Indigenous aged care facilities in other parts of the world, but I've heard speak of here in Australia with mainstream services encouraging younger people to come in, with play groups even being housed in aged care facilities as a way of actually ensuring that the community comes into the residential facility. The second actual theme that we identified in this systematic review was the need for services to promote independence. And this actually was quite strong in one particular study that went on, where one of the participants was very keen to emphasise the fact that he was not sick. He was just old, and that didn't mean that he was incapable of doing things. So one of the areas that came across very strongly, both from not only the aged care or the older person's perspective, but also from their service providers, was the need to allow people to live life on their own terms for as long as possible, rather than those that are actually determined by primary healthcare or aged care staff and the rules that often go behind that. And this, I think, speaks very clearly to the idea of the patient-centred perspective that is coming through now in both health services but also in aged care facilities as being extremely important. There was also, the review found a need to support people to contribute to continue to make meaningful contributions to their community, whether that be in caring for family members or passing on traditional knowledge, again, to the younger people and younger generation. But also importantly, to disseminate information and strengthen skills of older Indigenous people and their family in order that they can make informed life choices as well as end-of-life choices, to let them know what is available and how they can go about making sure that their decisions and choices are actually facilitated. So there's, I guess, an advocacy job for aged care services to take up. So the final theme that came out was the idea of delivering culturally appropriate care. And some of the issues that were actually driven home in this particular theme included ensuring primary healthcare and aged care services are culturally safe. That is, free from prejudice and judgment. The idea of cultural safety, as many of you would probably know, comes from a Māori perspective, and certainly was a frame that was developed in New Zealand. It talks about the need to provide culturally safe services from the perspective of the receiver rather than from the provider. So, and it's always the provider who is the one that actually is responsible for that. So in our review, it appeared that older Indigenous peoples tended to care less about how the facility looked and more about the way in which it functioned. There was also a need to enable Indigenous people to play a role in designing and managing services intended for their ageing community members. And this takes up again this idea that is very strong in the community here in Australia, with the provision of primary healthcare services that are community controlled. And perhaps there is a need to ensure that there is a greater range of community controlled services in the aged care sector as well. There is also a need to consider a range of holistic care programs that are designed to meet the needs of older Indigenous people, which include those that focus on the trauma and provide support for people who experience that trauma that comes as a result of discrimination and oppression. And this might not be a service that's necessarily required by members in a mainstream service in every case, but it might be something that needs to be considered for our Indigenous peoples. So encouraging older Indigenous peoples to remain active was also considered to be important in organising walking groups, in taking part again in cultural activities, including you know, perhaps going back to their community for the very significant events that go on. Assisting and advocating for older peoples and their families to access entitlements was also considered important, such as pension, housing and disability services, and also the need to offer understanding and care to older Indigenous people who are often dealing with the death of their peers at the same time as their own failing physical health. And while that stands true, I guess, for every older people, the important thing here to remember, I guess, is that for many Indigenous people across the world, older is somewhat younger than in mainstream services. So in thinking about, I guess, what this really means, and taking that back to the literature that we already have available to us and some of the experiences, that we already know about. I guess the first synthesised finding in the review, which was around maintaining a strong Indigenous identity, is really something that literature has addressed very closely, but perhaps not in the aged care services. There is strong evidence to suggest that cultural identity promotes resilience, and also Indigenous identity is strengthened through connections to community, participating in traditional activities and being on country. And that these sorts of activities are associated with a reduction in stress and also a greater well-being for people, or self-reports of greater well-being. The second systematic, or the theme in this systematic review, which spoke about independence, was actually quite a controversial one when we were thinking about the literature that's already been published on this. It's a complex area, and particularly in aged care services, where we immediately think about aged care people, we also think about their loss of physical health and their inability perhaps to do the things that they normally would have done in the past. And this is perhaps true. However, we believe that aged care services can actually facilitate independence by supporting people to do the way in which do the things that they would like to still keep doing and what they have done previously. And so therefore independence is very closely associated with a sense of dependence, which was the support of the health services and the aged care services, so that people can continue to play an important role in their own communities. I guess through the last one, cultural safety was something that underpinned and was associated with the two previous findings around Indigenous identity as well as independence. So cultural appropriate care, which has been well defined, or has been tried to be defined, I should say, in the literature previously, is often referred to as involving working with Indigenous people and their communities, supporting the wellbeing of older Indigenous people, including their cultural connectedness and balance with their families, communities, etc., falls well within the cultural safety framework that I spoke about earlier, that was put together by the Māori population. It does extend well beyond being aware or sensitive to cultural differences. Culturally appropriate services, however, which support the wellbeing of older Indigenous people, according to the findings of this review, will ensure people are able to maintain their Indigenous identities and promote independence. So we're pleased to say that this systematic review paper has been recently sent off to a journal. We're hoping to be able to publicise it shortly as being accepted, but we are awaiting obviously the reviewer feedback on this. However, we are not sitting around waiting necessarily for that. We do have developed a program of work, or started to develop a program of work with the Expert Advisory Committee. And this includes really now focusing on, given the findings or the global findings that were in the systematic review, understanding these from the perspective of Australian Aboriginal and Torres Strait Islander communities. From that work, we are hoping to develop and then pilot a framework for both primary health care and aged care services. And importantly though, while the framework will assist these services to actually support the care, importantly it will actually be quite flexible, we're hoping, so that people can actually make use of it in different contexts. Along with the framework, obviously, what we're hoping to do as well is to gather resources that are already being developed and also perhaps produce those that are still needed to support the implementation of this important work into these particular services. So I guess on that note, what I'd like to do is to acknowledge the work of or the support that has already been given to do this initial stage of this program of work. Certainly, we acknowledge the funding that was provided by Helping Hand Aged Care Services, and also they're allowing to have one of their senior people on the Expert Advisory Committee. And we also obviously have to acknowledge the NHMRC CRE funding, which also supports this work. Thank you very much for listening, and if you require any more information, I'm sure that I'd be only too happy to respond to any emails. Thank you.
Thanks, Carol. That was really interesting, and you may have noticed that we've got some participants. I apologise for the problems at the start, but we've got eight participants now, so that's great. I'll ask a question, but just for the people, the participants, if you've got any questions, you can just type them into the, if you click on the Q&A button and type any questions that you've got, I can relay those to Carol.
If you like, John, I could actually make everybody a panelist. There's only 8 people, and then they can ask them directly. Okay. Do you think that might work? Well, see how it goes. So what you asked your question, and I'll sort that out now.
All right. Thanks, Carol. Yeah, so that systematic review sounds extremely valuable. I was just thinking about your next steps that you were talking about. So you're talking about understanding well-being in the Australian context. So is the purpose of that really to validate the findings or the conclusions from your systematic review, to check that they're applicable to the Australian context?
No. It's from the other perspective, John. What we wanted to do was just to simply identify what other populations have done around the world, and then to use that as a basis for understanding what might be applicable or appropriate from an Australian setting. So we are going to start almost a little bit from scratch in going back to communities and identifying what they particularly feel is important for them. And then from that, then check back to see whether any of the other strategies that have been used that may not have been mentioned might be applicable as a prompt. So this is a methodology that we've used in the past, which has been really successful. We recently, or I was part of a team that recently completed the development of a wellbeing framework more generally for primary healthcare services. And what we did there was, again, start with a systematic review. We then got together a research team of 13 Aboriginal community-controlled health workers from across Australia as researchers, who came in and actually supported us in the research process. They helped collect data. They came together on a number of occasions here in Adelaide from all across Australia, and they facilitated the interpretation of the data. So this was actually getting that contextual perspective and the community perspectives involved. We then took the framework back to the community to see how they would respond to it before finally producing the final framework, which is available by website, and I'd be happy to give that out to people if they so choose. So it was just a very initial starting point to see what has been done in the past, rather than trying to validate what we found. Does that make sense? Sorry. Yeah.
So Natalie's just asked the question about the quality assessment, which says for our, but I think for your systematic review, So, and you mentioned that you just submitted it for publication, so that there isn't a draft version available.
No. And I just have to correct that. Unfortunately, this is a long process. So we have used, for this systematic review, we used the Joanna Briggs Institute qualitative appraisal tool. But because I've very luckily been involved in a methodology group, which is developing a systematic appraisal tool to look at the quality from the perspective of Aboriginal and Torres Strait Islander peoples of research to be included in a systematic review, I started to think about some additional really important things to think about, and that's why we added was there an Aboriginal and Torres Strait Islander researcher, and was there a reference group made up of, in this case, Indigenous peoples. So we're hoping to publish the tool shortly. It's going through a piloting process, an internal piloting process at the moment. And so this is the work that's been done primarily by the Aboriginal and Torres Strait Islander researchers here at Wadley Paringa, together with the Joanna Briggs Institute, which of course does the systematic reviews and has developed their own appraisal tools. So it's a collaboration, but we will provide that to people as soon as we possibly can, once we're comfortable with it.
Yeah, great. I don't know if there's any other questions. I guess one other question I was thinking is, what are your timelines, I guess, in terms of your final product, which will be a framework?
Oh.
So I just, what are your timelines to get a framework out?
Yeah, sure. So we need to take this slowly because it's really important to check back at every stage with the community, even though we have an expert advisory committee on board, and they're very integral to the whole process. They're more of fellow researchers than an advisory board, I would suggest. We need to check back with the community at every stage, so this will take a while. So we're envisaging that the framework should be ready within the next 18 months, which, it's probably the reason why it's speeded up a little bit is the fact that we've done this process before and we have the connections with quite a few communities across Australia. So we're hoping that will speed it up, but of course we have to allow for the community to actually define the timelines that's necessary for them.
Okay, great, thanks.
Sorry, it doesn't seem to be working having everybody on the mics. So if people have got questions, put them in the chat box or the Q&A box. There's a bad hum when we put everybody on speaker. Okay. Yeah.
There aren't any further questions. I think that's a testament to the level of detail you provided us with, Carol. I think it was certainly very clear. And like I say, the findings from the review seem very interesting and relevant. So I'm afraid we can't give you a round of applause. But we're all doing that in the background. So thanks very much.